Welcome back on Me&my Health Up podcast show. How are you doing, Samuel Minkin?
Yeah, really good. Good to be back on the show again. Really excited for today's talk.
Yeah, the trilogy. So we did a prior talk on the vagus nerve, which was essentially part one. Obviously, you've got lots to share in terms of the update since that episode, because from memory, it was probably the beginning of last year. It was quite some time ago we did that episode. So obviously, a lot's transpired in terms of new research coming out. You're keeping up to date with the new research, so really keen for you to share that with the listeners today and get the latest insight in terms of the vagus nerve and the importance it has in terms of our physiological behaviour and our well-being, and also keen for the listeners that may have missed that episode 18 months ago for you to share how you've arrived at your profession as a musculoskeletal therapist.
Well, so I first arrived at becoming a musculoskeletal therapist while I was working in sports medicine, working with different sporting teams, attending to different injuries, and a friend of mine actually hurt his back. And I noticed a rapid decline in his mental health as well from when he hurt his back. He became quite isolated. He didn't want to leave the house, and it was outside of the pain as well. It completely changed his personality. When I started the degree, we learned about the physical issues with pain and all the musculoskeletal stuff. But the degree went more in depth and talked about how pain, particularly chronic pain, can develop into depression, and that depression actually increases the person's pain. And that person's pain increases their depression, and it's quite a nasty spiral. And the way we were taught how this affects it is the brain, that there's morphological changes that occur in the brain when people are going through chronic pain. And those different changes in the brain, usually it's involving the amygdala, which is the emotional center of the brain. There's actually an area of the brain that processes pain as well. And it gets larger, it gets bigger due to the chronic pain. Vagus nerve stimulation is something that we can use to directly target things like the amygdala in different regions of the brain. So, for instance, if someone's coming to me with chronic pain and they've got depression, I've got to help with their depression as well. It's no longer a simple task of some acute injury or acute pain. The brain has changed the way it's perceiving the pain. It's got different triggers. And vagus nerve stimulation is one of the best ways to address that. And it's not invasive. So that's sort of how I came into this vagus nerve realm in regards to musculoskeletal therapy. It just made sense.
And in terms of the vagus nerves, some of the listeners, that missed the earlier episode wouldn't be really familiar with what is the vagus nerve, what role does it play within our physiological well-being, and if you could just share that insight to bring them up to speed, that'd be great.
Right. Well, so the vagus nerve is the 10th cranial nerve, and it actually comes off the brainstem. And you've got two vagus nerves, a left vagus nerve and a right vagus nerve. And they're coming off the brainstem, and they're coming all the way down, and they're supplying areas involved in speech. They're supplying, the heart, setting the rhythm of the heart. They're supplying the stomach. They're setting or regulating stomach acid regulation. It's supplying things like gallbladder, the intestines. It pretty much supplies nearly all of your organs, and it links your organs to your brain. So your brain knows what's going on down here. But funnily enough, it also informs the brain on different levels of neurotransmitters, which is something that's sort of come about in the last few years. And that has a huge role to play in regards to improving brain regions to improve hormone regulation. So all this vagus nerve is it's a nerve that's linking your brain to all your organs and back. And it gets turned off by stress. It really is the parasympathetic nervous system, and things like stress really suppress it. Other things can be like a gut infection, things like food poisoning. But some of the more recent things I'm starting to see is issues with neck instability. So people having neck instability, or maybe they've got a condition called Ehlers-Danlos syndrome, which basically means that they've got hypermobile joints throughout their body. And this neck instability and this head forward posture, it compresses the vagus nerve physically. And a lot of these people with these vagus nerve problems, they're coming in and they're saying, I've got reflux, or maybe they've got issues with they've got leaky gut. The vagus nerve actually regulates gut permeability. It also regulates the biodiversity of the microbiome in the gut. So it's sensory. 80 to 90% of the vagus nerve is sensory. It's sensing things like, how much stomach acid do I have? Do I need to pass a stool, or have I passed too many stools today? It really sets the rhythm of peristalsis. And it's really important. And if you think of all the symptoms of stress, they're literally dysfunctions of the vagus nerve. So if I was to list off the symptoms of stress, I'd say anxiety. I would say people get reflux when they're stressed. I'd say some people, they get constipated when they're stressed. They get diarrhea. They get irregular heart rhythms. They have difficulty with their working memory. They can be quite flustered. They're sort of they're looking for something, or they walk into a room and they forget why they even walked into the room. They've got this issue, and they start to think what's going on? They some of these people feel like they're quite literally falling apart. They can't perform tasks anymore. They've got quite a substantial amount of brain fog. Brain fog is sort of feeling things are quite challenging. Simple tasks, you feel like you're sort of behind this hazy mirror and you're unable to think clearly. And we know that comes back to brain inflammation or neuroinflammation. Again, all these symptoms, they're all regulated and roles of the vagus nerve, and all stress is vagus nerve inhibition. Well, all the symptoms of stress are directly correlated to the vagus nerve. So I think it's really important, because there's a lot of people who they've got different stresses in their life, financial stresses, relationship stresses. And because we're so busy in the way we are, we can often forget that these things are happening. And we've had all these, maybe we've had a bit of bloating and we've had some reflux for a few months. But in the next, it's a year, and we don't even know how we got to this end stage where we're in a bit of a crisis, that we really need to seek professional help.
And obviously you mentioned some key symptoms and signs for people to watch out for, in terms of maybe they have some vagal tone downregulation, or a not as active vagal tone. Is there a specific test that you can actually do to test the vagus nerve tone, or its ability to operate as it should?
Yeah, so there are a few key roles of the vagus nerve, the things that you can test. And I wouldn't use them in isolation. I would probably use a couple of them together, just so you get a bit of a clear picture. For instance, the gag reflex. So the gag reflex is controlled by the vagus nerve. So people, they may have a low gag reflex, or they may not even have a gag reflex. And you've got to test both sides of the throat, because you've got a left vagus nerve and a right vagus nerve. You might find that when you get a tongue depressor, or maybe you don't have that, you've just got a pen, and you're just touching the back of your throat, you may go that's quite gaggy. And then you touch the other side and you go, yeah, that's not as responsive. And ideally, there should be equal. Now, if you're identifying that one side's a bit more gaggy than the other, or vice versa, that can be relevant. Now, other issues pertain to the uvula, the dangly thing in your throat. So when you go, and it's lifting up, you can't see it at the moment, but when you look in the mirror, you'll see you've got this little dangly thing in your throat called the uvula. And when you go, it should lift up. Now, some people's it doesn't lift up. And what a lot of people will find is, mine lifts up, but it should lift up quite high. I'd be saying that at least 1.5 inches The uvula should be lifting up, and it should be able to stay up. Now, what people might find is they go, ah, and it drops down while they're like, ah, or it's shaking. That's relevant. Other issues relate a little bit more to sort of physical overload of the vagus nerve or even some compression, is if you're palpating just through here, and I wouldn't say I'm pushing hard, and it's sort of at the angle of the jaw. You got this, you kind of go up and through here, and if it feels bruised, with that pressure, it shouldn't feel bruised. But people with vagus nerve problems, particularly ones where they've got a bit of neck instability, a bit of physical compression, or maybe they've had a motor vehicle accident and it's the traction didn't traumatize the nerve, it's quite sore. So physical tenderness is a really good indicator. Having a lack of a gag reflex and also poor uvular elevation is a really good one. And those are sort of the simple ones where you don't have to get too complicated. There's newer ways of testing vagus nerve and its relationship to pain and its relationship to like irregular heart rhythms, and that's using a heart rate monitor. You can just get like a little one. I've got a little one just here, and it's this little thing here. You put it on your finger, and it says your heart rate. Now, what I've been doing recently is I've been ascertaining their heart rate and then getting them to just move into the painful movement. And your heart rate shouldn't go up by much. If you're going into a painful movement, your heart rate goes up by 15, 20 beats quite fast. That indicates that the vagus nerve's not really stepping in to put the brake on the sympathetic nervous system. It means that people's low vagal tone is increasing their pain. It's increasing their brain's perception of the pain. And this all goes into the picture of trying to treat the person holistically and get the best result.
And so how is it? Like, so this patient's come to you, they've, they're saying I've got digestive issues, I've, not moving my bowels, I'm feeling a bit of acid reflux coming up every now and then, I'm, really stressed out. You start, you've run them through the test that you just shared with us. What's the next step in terms of working with that client? How do you then help them, support them holistically?
Well, what's really important is just ascertaining whether there is an issue with the neck. So because of the vagus nerves and them running just in front of the bones in your neck or the vertebrae, if we're just doing vagus nerve stimulation, and this is the vagus nerve device I use, if we're just doing vagus nerve stimulation, then we'll probably find that, they're going to get improvements. They're going to get less reflux. Your heart rhythm problem is going to be improved. But we're still missing a key compression or entrapment of the nerve. So I just rule that out. And that's pretty easy to rule out because a lot of the time you take their heart rate, you decompress their neck or you support their neck, and it changes their heart rate. Their heart rate goes up by 20 beats a minute, which isn't normal. So once I've ruled that out, get them on vagus nerve stimulation, and we just do some electrical stimulation through the ears. Now, since I saw you last, we used to use 2 clips on the ear. It's a lot simpler now, so really good for people trying to do vagus nerve stimulation from home, is you've got this one clip and it just goes on the ear up here. And it sits in this little nook. And once you've got both the clips on, we'll do some stimulation, depending on what we're treating. There's all different protocols that treat completely separate things. And it's important that you get the frequencies correct. If you can't just put stimulation on the ears and expect that you're going to get it right. Now, the difference in the research from doing like 1 hertz compared to 2 hertz in headache research, 2 hertz had a 30% greater improvement than the 1 hertz. And it's such a minute change. So it is really important that the protocol is done right. A lot of vagus nerve, I'd say, assessment and treatment, a big role of it is the health history, really getting a big picture of when did it start, what are all the symptoms. Like, people with vagus nerve problems don't just have one symptom. That's the thing. It's not like, oh, well, if I've got reflux, well, I've got a vagus nerve problem. people with vagus nerve problems have multiple symptoms. It could be reflux, and they've got bloating, and they've got diarrhea. They've got fatigue. It could just be issues with poor inflammatory regulation. They're just very inflamed. They're lethargic. They've got brain fog. Difficulty swallowing is something I see quite a lot. People just think like, I've had difficult swallowing for years. They don't know it's relevant. So it's really important to ask a whole bunch of questions and work out to what extent. Have they had surgery? Cervical surgery, thyroid surgery, really common. There's a lot of instances where there's been titanium clips put onto the vagus nerve by accident, because it's such a small nerve and it's quite delicate, this area. So, it's all health history and then assessing for neck instability so we don't miss something. And a bit of nerve mobilization. Like you can actually palpate your vagus nerve just through here. And what it will feel like, because you've got quite a few nerves through there, feel like a whole bunch of clunky things. So you're not going to be able to isolate the vagus nerve, but you've got the vagus nerve, you've got accessory nerve, you've got a whole bunch of nerves sitting there quite close together. It's usually a bit medial to the pulse. So when you find the carotid artery, go, yep, I got that pulse. You just go a little bit more medial and towards the spine, and you'll go side to side, and you'll feel like you're sort of clunking over something. And you don't need to push hard. You just need to go, okay, yep, there's something there. Side to side, working side to side, just freeing it up. That's one of the manual techniques. There's other techniques like flossing the vagus nerve. So because the nerve comes from the neck, goes into the thorax and supplying all these organs, you can do some flossing. And it's sort of, you might flex and I'll show you on the camera. You can do some stuff where you're actually closing down like this. And then you're really extending, looking up, staying, closing down again. And really extending. And that's a manual way of improving the vagal sort of nerve mobility. A lot of these issues are because there's been a bit of head forward posture, had some poor postures, a bit of kyphosis, and we've been in this slumped position. We haven't been upright. So nerves in general, blanket statement, like mobility. They like mobility, they like blood flow, and they need the movement. So if you don't have good movement of a nerve, it's not going to function right. It's going to be annoyed. You're going to notice maybe weakness in muscles or altered sensation in skin.
And so how do the listeners get that good movement? I mean, you just showed us and demonstrated that exercise. I assume that's a good movement for the vagus nerve tone. What else can the listeners do to help support their vagus nerve?
Well, dietary, things like choline are quite important. Choline is in the yolk of eggs. If people aren't eating eggs, then I'd say maybe supplementing the choline or just looking into the diet. Are we missing vital things that the nervous system and the nerve itself needs? General movement's important, particularly extension movements for vagus nerve. So a lot of movements we do, whether we're sitting at a laptop or a computer, we're sort of closed down. We're very rarely upright. So even getting a foam roller, putting a foam roller on the ground, laying it across your back, not down the back, and spend some time extending over it, and even using the head like that, and a bit of flossing. 20 each side. And some people, when people who have got vagus nerve immobility, they can feel it. So as they do it, they're feeling a pull into their chest. They're like, I can feel like a tension really deep in my chest when I do that. And they've got poor vagus nerve mobility. So manually mobilizing it, flossing it like that, Yoga, like that, they say in yoga that the upwards facing dog is the best yoga position for digestion. And it makes sense because it's a neurodynamic for the vagus nerve. So that's how it's doing that.
And in terms of like your top 3 tips in terms of, are they sort of the top 3 that you'd summarize as to how someone would support the vagus nerve? Or
I would say definitely movement. So you want to do some nerve flossing. You want to kind of get your fingers. Again, you're not pushing hard. You're not trying to wreck this thing. You're just trying to give it a bit of movement, make the nerve a bit noodly. Some side-to-side movement through there. Another really good one that's quite powerful is a mammalian diver's reflex. So just you need to do a bowl of ice water. You can put your face in it. And 20 seconds. You 20 seconds with the face in the ice water. You come out, have a rest. Do that another 4 to 6 times. And you can do that 3 times a day. Now, some people don't like the bowl of ice water. You can get an ice pack. And you need to be applying cold pressure around this region. So really pushing on that region. And that's another really good exercise. I get all my patients to do this. When I first began doing vagus nerve stimulation, I was just doing the stimulation and getting them to do a bit of gargling and stuff, but it's quite evident that there's quite a significant improvement when they're doing those exercises as well. So it is quite an important part. And managing stress.
Fantastic. It's such
managing stress.
Yeah.
Like if there's things you can avoid or there's things you can manage, maybe it's setting aside a bit of time in your day to do some mindfulness or some meditation, just implementing some things that help you manage and deal with your stress.
And given that we've been through the pandemic and, people's worlds have been shifted around and now we're faced with floods here in Queensland, New South Wales, and, it seems to be one after another. Have you noticed an increased cases of, this vagus nerve dysregulation or, lack of tone with your clients?
I have, yeah, particularly in nurses. So through the pandemic, towards the end of the pandemic, just the amount of work that they had to do. A lot of the hospitals were short-staffed, I suppose, because a lot of nurses walked off the job. And that put a lot of load on other nurses. And, I've had quite a few nurses have nervous breakdowns. And it's, they don't really know about the vagus nerve either. They don't know that this is a vagus nerve problem. They just think, like, I need a break from work. And they do need a break from work. But for something where there's significant stress in your life, doing these practices are really important. And getting into a clinic, trying to get some vagus nerve stimulation is really important. I think we're so busy trying to do the best we can, and we often put our personal sort of management or things that we need aside. And I think at the end of the pandemic, to answer your question, I think a lot of people put that stuff aside. They were just trying to get everything they needed done, and particularly with flooding and stuff, like when your house is flooding and you've got to pack things up and you've got to go and you can't get everything, the last thing you're going to do is stop and do some breath works and stuff like that. But it is important to identify when you're getting a bit overloaded, when you're feeling a bit like, I'm feeling overwhelmed, and working, okay, well, when today can I do it? 3 p.m. Okay, well, I've got a time there. At least if you spend 10, 15 minutes. 10 minutes is great. 20 minutes is even better. Put some frequency music on, and if you don't know how to meditate, and listen to some guided meditations. Like when I first started learning to meditate, I had no idea how to meditate. That's sort of what stopped me, because I was like, well, I don't know if I'm doing it right. But just for the listeners out there, meditation isn't the absence of, thoughts. It's the practice. It's a meditation practice of identifying when you've lost your train of thought and then just bringing it back. Now, you can bring it back to your breath. You can bring it back to a feeling. Now, when you first start meditating, you're going to lose your train of thought again. You're going to go, oh, I'm thinking of the shopping list. That's fine. Identify that you lost your train of thought and bring it back. And just keep bringing it back and keep bringing it back. And the more you do that practice, the longer durations of time you'll have without losing your train of thought. And if you did a meditation practice and you sat there for 30 minutes, didn't have any thoughts, and didn't get distracted, well, that's not a practice. You didn't learn anything there, and it's not challenging. So meditation, I didn't know this, so that's what put me off. But now I know that, if I lose my train of thought, I'm just bring it back and bring it back. And then before you know it, you're like, oh, yeah, I can feel that sense of ease. I can feel that I'm resting better. And all I'm doing is meditating.
And so meditation's obviously part of your daily routine. What else do you do that you find that really works for you, and where you fit it into your day around what we've discussed around this vagus nerve support?
Green room therapy. So I get out into nature. I've just moved to a really nice place in Currumbin Valley, and I'm really close to the Cogal Cascades. So getting out there at least twice a week. Whether I get up in the morning and just go for a walk, have some of the flowing water over my feet. You don't even need the water, just being in nature. So spend about 20 minutes in nature. The research shows that's really good for anxiety and depression, just being in nature. Now, there's separate research where people, doing some grounding or earthing, and you're taking your shoes off, being barefoot on the ground. Maybe you can combine both of those. Maybe you can go barefoot, walk through a park, walk through some nature. Those things are and they're free. They're free. And then there's blue room therapy. That's just getting to large bodies of water, or the ocean. Spend some time at the beach if you're able to. It all adds up. If you're doing 5 lots of 20 minutes a day, you accumulated this. It's just getting out and doing it.
Fantastic. I really appreciate everything you've shared. I love the insight around the exercises, the flossing and the stretching, and I get that flexing and crouching forward. I forget what that was called, but the ice bath, the mammal.
Chameleon dive reflex.
That's it. That's the one there. Mammalian dive reflex. So that's ice bath. Head in the ice bath for 20 seconds and doing about 4 reps of that, sets of that. It's been really insightful. So how can the listeners connect with you in terms of reaching out and getting further support?
Look, the best way is either going to my website, which is just www.recuperatehealthandwellbeing.com, or I've got Instagram, recuperate_health. I get quite a lot of people just messaging me questions and stuff. And I'm really keen to give you some insight. I want to help you get the best therapy you can. If you're not in Queensland where I am, I frequently go down to Melbourne and Sydney and see patients. I've got patients in South Australia I'm doing through telehealth, people in the United States. But I think there's no harm in asking for advice or asking, what do you think? I think, so feel free to send me a message. I really love to help you.
Fantastic, Sam, and I'll include those links in the show notes, and really appreciate you coming on for the trilogy. So we've done 2 episodes on the vagus nerve, so very insightful, and the last one on laser light therapy. So it's great to tap into your knowledge, a wealth of knowledge, and you walk the talk, which I really admire. So you're certainly out there putting it all into practice and keeping up to date with the latest and emerging research. So your clients get the best care and treatment. And don't forget to follow Samuel on TikTok. He's also a TikToker, so he's got some great tips on TikTok there. So I'll include his TikTok handle as well for those on TikTok. And for the listeners, thanks for tuning in for another insightful episode of Me and My Health Up. If you heard of any of those symptoms that you know that are present with your family or friends, please share this episode with them. It may be of help and assistance. So please get it out there to friends and family that may need some support around their vagus tone. Or if you know a nurse, this episode is for them. So thanks, listeners, and thank you, Samuel.
Thank you very much.